So I had a bridge that basically failed, and I reached a point where I either had to replace the bridge or I had to do something else. And so when we talked about doing an implant, the scariest thing for me with the implant was the whole concept of having a piece of metal or some other object infused inside of your jawbone. And that sounded to me gruesome, painful, extremely uncomfortable, longevity to the concerning issues and problems, which is farthest from the truth. So my experience with this was in any kind of dental work that I get done, I usually get some sedation. And so in that particular time where I got sedated, the appointment lasted for about an hour, and he had 2 implants that he had done on the side on my bottom here to replace molars. And the pain, discomfort was nothing different than if you had a tooth pulled or you had a root canal done and you were sore for a couple of days. I had absolutely no pain, no discomfort on the jawline. There was nothing I felt. It was only at the gum line, and it was simply just sensitivity to what I had described, and that was a tooth being pulled or some kind of root canal being worked on. And that was it. So, and I've had now, you have to go through a period of 3 or 4 months where you have to let the implant kind of get itself grown into your jawbone a little bit. And so I haven't gone through and gotten the final stage where I'm going to get the crowns put on, but absolutely no issue whatsoever. I mean, it was a piece of cake to go through. And you really search the internet and you really look at YouTube sessions, there's nothing out there that kind of really describes that process. I went to another session with a service that wanted to pull all of my bottom teeth to replace it with some kind of a funky, appliance. And I thought that was way too drastic. I thought that was way too extreme. And again, I just went for this simple routine, and it turned out to be a very simple process.